when you go to the dentist, you interact with so many people. And one of the things that I personally love about going to your office is I love your staff. So I'm really glad they're all here today.
Well, it's really fun, Brenda. You know, I think you're right. We're really only as successful as our dental team. And the reality is you probably are visit with and talk to more and rub shoulders with more with the dental team than you really do with the dentist himself. And so I'm proud to have him here today. It's going to be a great show. They have tips, and they're going to give you their tips on good oral health. First start with our dental hygienist, and her name's Ashley. She's here, and what we've asked her to do is, you know, every day, Brenda, there's themes to the day. So certain questions get asked over and over and over again, and so those are common things that people want to hear. So what I've asked our team to do is say, hey, listen, take some of the stuff that you get asked commonly, and let's talk about it on the air, because chances are if our patients have questions, our listeners probably have those similar questions. So we're going to start talking about dental hygiene. Let's talk for a minute. What are some of the most common things that people ask you, or common concerns or themes that we tend to find in your dental chair?
I think people are just definitely, wanting to know why they need to come to the dentist every 6 months. And it's just very important to come in to get the cleanings, because the health of your mouth is going to greatly affect your overall health of your body. And once your plaque hardens to calculus or tartar, no matter how much you brush or floss, even if you're amazing at home, you're not going to be able to get that off of there. So just to promote wellness for yourself, it's very important to come in and see us. Another big question that I get asked, is what is gingivitis, or what's periodontal or gum disease? And with the gum disease, that's really a silent disease, and a lot of people, they don't know that they have it. So it's very important for them to come into the office and have an assessment done so that we can find out, if they have problems with the supporting structures around their teeth and the level of their bone support.
Most important. But here's some indicators. Bad breath. Okay? If you taste blood in your mouth. Altered taste. So, you say, I have a metallic sort of taste in my mouth often. That can be an indicator. People saying, should I have a manual brush or should I use an electric brush?
That's a good question.
And they look at it and you say, for $2 I can have this manual brush, and for $100 I can have this electric. Is it that much better? What would you say to that?
I would say in most cases it is going to be a lot better. I personally think with an electric toothbrush it's going to be a lot more effective in plaque and stain removal, and especially for children and things where they maybe don't have the dexterity to do it on their own. Those kind of aids are just going to help them and be able to get the plaque off a little bit more effectively.
Welcome back to the second hour of Peace of Mind. I'm your host, Dr. Scott Grant. Today we're talking about dentistry, we're talking about dental care, and we're happy to take any dental-related question that you may have. And let me give you the phone number. The phone number is 465-0730. You're listening to KINF, and we're happy to be here with my dental team, Brenda. We're talking about dentistry today, and we're trying to give our listeners some tips and some pointers on how they can improve their oral health.
All right. So, if you have questions about bleaching, go to your dentist and ask what is best for you. Do you want something that you can do at your home? Do you want something that you can do at the office and come out of the office brighter and whiter? You'll just have to talk to your dentist and see what is best for you. And maybe you have an event that you want to be whiter for, so maybe you want something done faster. Or maybe you just want them whiter and so you have plenty of time, and so you just talk to your dentist about which one of the systems works best for you.
Let me throw this out. We've had a few examples of where people come in and they say, and I remember one that was my favorite, I need to bleach my teeth, I'm getting married. And I said, when are you getting married? And the individual said, tomorrow. And I said, okay. So let me say, if you're getting married or have an event, it's best if you can give yourself 2 to 3 weeks. So if you're engaged out there and you think you want to do it, put on your wedding planner 3 weeks before the wedding. That's a better time than 1 day. We got him white, but he paid a price there. So, in terms of some sensitivity, because you have to be a little more aggressive. If you have a couple weeks, it's a better option. Yeah. So go ahead. What else?
And so, one of the things you just brought up was sensitivity. Some people get sensitive when they bleach, and they wonder, oh no, did I just ruin my teeth? Have I damaged myself? And no, you did not. Sometimes you get some sensitivity when you bleach. It goes away. It's not something that's permanent. There's a lot of really great products out there that we actually use in our office that has some desensitizers in the bleach. So you don't have the sensitivity, but it does happen to a lot of people, and it's not something that's permanent, it's not something that hurts you, and it's totally okay.
Welcome back to the second hour of Peace of Mind. I'm your host, Dr. Scott Grant. We're here today talking about dentistry. We're very pleased and excited to have our dental team with us. They've given some great tips. We have more tips, and we have our next dental assistant with us. She's got some great advice, but I want to remind our listeners before we do that you're listening to KINF. If you have any dental-related question, we'd be happy to take that here on the air. The phone number is 465-0730.
Alrighty.
So we have them come in, we give them a ride on our really cool chairs, we show them all of our instruments, and we even have a little book that we read to them about teeth. And sometimes if we're lucky, we can get a cleaning in that day. If not, at least they had a positive experience and we get them back in the schedule and try again. Sometimes it takes 2 or 3 times before they warm up enough to trust us and let us stick something in their mouth and clean their teeth. And, as parents go, we really encourage parents to make it a positive experience and to, not dwell on the negative. Try not to threaten your kids and scare them, because we find that if parents have dental fear, a lot of the times their children do too. And it makes it really hard as a dental assistant to try and convince children that, it's not scary to come to the dentist. It should be a fun thing. So, just try and make it as positive as you can. Today you're going to come in, they're going to, let you ride on a chair and just look at your teeth. It's nothing to be scared about.
And the best part of the whole visit, don't forget, what do they get at the end?
You get to pick a prize out of the toy box.
Yeah, you always focus on the positive. Remember, you're building the foundation. And these little kiddos have a lifetime of oral health needs. And we need to help them at a very young age feel confident, feel comfortable, and to have a great experience. And I love what Cody said. It's really true. When mom comes in super anxious and is really nervous about it, the children feel that, whether she says something or not. So what would be best is to just trust them in the hands of a good dental assistant. The dental assistant takes great care of them, helps them to have a positive experience, and answers all their questions, and they have a great foundation to go on.
Here's the whole team talk.
Absolutely. Our team is so important to our success of our practice, and I believe that. I believe that you're really only as good as your team. And you really are going to have more interaction with the rest of the team probably than you are with the dentist. And so we've built a team that we're very comfortable with that does a great job for us. We have with us here Erin. She handles our front office duties. So she specializes in certain areas like if you're wondering about your insurance policy. Insurance is one of those animals we've talked about on the show that can be very confusing, and Erin does a great job of helping you work through that maze. Finances, for how do you pay for stuff, over what period of time, what's important now, what's important later. She walks through all of that with you, does a great job, and we are glad to have her on the show with us today. Tell our listeners out there, what are some common themes you find?
We get a lot of people that call in and, they want to know pricing, whether they have insurance or don't have insurance, and they're a little bit, worried about if they can afford the dental work they need. And what we want to tell them is we do have different forms of payment options, and, we do discuss with them if they request it, what their insurance will pay and how much out of pocket. And we just want to let them know how important their, smile is. I mean, you smile every day. Pretty much the first person, or the first thing that everybody sees in somebody is their smile. And it is important to keep up with it, and I myself have some work I need to have done. And, since I've worked in the dental practice, I've decided that, it's definitely important to my overall, health that I do get, everything, all my treatment finished and completed. And I want to have the best smile I can possibly have. And it doesn't matter with price, so we can definitely work that out with you, and it won't be an issue, and we don't want that to be your main issue when you come into the office.
Just to say, well, okay, having never seen you and never met you, the price is X. Right. Because what can happen is if you get a certain type of crown for somebody else, you're not comparing apples to apples. So what we do, because we do believe you should be a consumer, is we tell our patients, come on in. We'll do a free consult, we'll talk to you, and we'll look and see what your needs are. And then once we know needs are, we have no problem letting you know what the cost of the service is. And what we've asked all of our team members, if you're just tuning in with us, we've asked them all, what is your most common question? What do people ask you the most? And so we're going to throw that to Cameo. She's here. What are some themes or some topics that tend to come up over and over time?
It's not so much a question as when I'm calling to schedule someone, or they call me to, they might be canceling their appointment, and they'll say they're canceling because they don't have insurance, or they've lost their job so they don't have insurance or changed jobs. And so they'll be calling to schedule, or I'll be calling to schedule them, and they don't want to come into the office because they don't have insurance and don't feel like they're going to be able to afford it. And so I just want to say to them that in the long run, it's going to be cheaper to come in for those 6 months cleanings, even if you're going to have to pay out of pocket, because if you put it off and put it off, you're going to come in eventually.
To our listeners, that dental care in and of itself is not necessarily expensive, but dental neglect is. And the problems can happen very quickly. So being at the dentist every 6 months is important, not only to take off the tartar and plaque like we talked about earlier, but to prevent you from having issues. There is many times in a day where we can point out a very small area to fix that you can fix on your own at home without intervention, that had you left that for a couple of years will become a big problem.